welcome to Smartness. This is Vijay Lakshmi. Today I am going to discuss about the nursing research. Then nursing research we are going to discuss about according to the syllabus. Introduction part I am saying now research process. So in this first we are going to study about the objectives. Define research and nursing research, state the need and importance of nursing research, describe the characteristics of nursing research, enumerate the steps in nursing research. These are all the things we are going to study in this nursing process. This is the process of nursing objectives. And next come for the research and research process. In that first you can see the definition. Definition means it is a systematic inquiry that uses disciplined method to answer questions and solve the problems. Research means it is the one type of systematic inquiry and you are getting for the method you are using and getting for answers to the questions, and you can solve the problems also. So this thing we are going to study in research process, how to get for problems and how to identify the solutions of the problems and how to do for the questionnaires and how to do clear for the answers. So these are all the things you are going to explain in research process. That is the definition. And what is the nursing research? So it is a systematic inquiry designed to develop evidence about issues of importance to nursing profession, including nursing practice, nursing education and nursing administration. So we are going to discuss about the nursing research in related inquiry of develop the evidence. So according to the evidence and practically proving then in the profession, including of any practices, all nursing practices and nursing education and administration also going to study about the nursing research. So means it is nothing but we are able to developing of about issues, what all the issues are there in the current society and how to the solve for the in the practically. So that thing we are going to discuss into the nursing process. And next come for the need for study nursing process. Mainly compulsory, it is very necessary and very need for the nursing research for future generation and gain the knowledge, practical skills, everything it will be useful for nursing research. And who are going to attend for the competitive exams also, it is very necessary for the nursing research. So competitive exams they are asking for so many questions in related of nursing research, and mainly they are asking related of how to identify the problem and how to solve and what method you are going to use. So these are all the things you are going, it is useful for nursing research, mainly to provide for evidence to nurse clinical actions and decisions, integrate nursing research and EBP. EBP means it is evidence based practice, provide border clinical changes from local initiatives by the nurses, develop new clinical knowledge and skills based on the research finding, find out what works best for the patients. So these are all the things you are going to study and very it is necessary for the nursing research. So provide for evidence to nurse clinical actions and decisions. So whatever is there, whatever problems are there, it should be for one evidence. Research means it is a one evidence to make a decision, to take the decisions in the clinically. And integrate nursing research and EBP also, it is one type of integrated nursing research and then evidence based practice. So according to the practice wise then based on that research integrated also, it will be useful for the nursing research. Provide broader clinical changes from local initiative by the nurses. So clinical setting changes, anything it's happening and what are all the initiatives how to take in the future, either in the and initiatives, everything it will be promoting and improving of their knowledge and skills in the nursing profession. Means they should know about the research and develop new clinical knowledge and skills based on the research findings. Whenever doing the research findings, you will get for the gain for the clinical knowledge and skills also based on the content and topic either problem. So find out what works best for the patients, and finally which is the best for the patient and which decision and which care, which treatment is the best for the patient, that you are going to do. So because of done for the research. Next come for as a next and continuation of the need for nursing research, moldly attitude and intellectual competence of the nurses and fill the gap between for the knowledge and practice, provide for basis of professional accountability, improve the standards of nursing education, refine the existing theories and to discover new theories. these are also it will be helpful for the nursing research, especially you want to be gained for intellectual competence, mainly attitude and intellectual competences of the nurses. Means in the any type of competences have to be get for the good and what we can say good impression. Either you can get for what are the knowledge and practice, and both will be different. So once if it is the what gap will be there for knowledge and practice, means knowledge is there, some people can't able to do for that in practically, some people are practically well but they can't able to do express in the knowledge. So these both gaps it will be filled because of the research. And provide base for professional accountability, and this is also providing it can be improve of professional accountability, improve for the standards of nursing education, can able to improve of your standards of education related of nursing. Then refine existing theories and discover for the new theories. Whenever you are going to do for what are the existing plans are there, according to that you make it for new plans also, that is the theories we are calling. These are all the things sake also it is very helpful for the nursing research. And next come for scientific method. So in that scientific method, so what is mean by scientific method means it is a proven. So it is a we can say for what is that means it is a one systematic and it is for very and true, and what is that practically it is proven, that we are calling as a scientific method. That what is the definition means it is defined as a set of orderly systematic control procedure for acquiring empirical information. So in the scientific methods law we can use for the systematic and controlled procedures for acquiring for empowering information. So scientific method for using the introduction of deduction together and good system of obtaining the knowledge and having more reliability than the traditional one also. Means what are the traditional ones are there, that will be only saying for the systematic obtaining for knowledge. So once if it is come for as a reliability, in that reliability has to be coming from scientific proven only. Once if it is proven for scientifically, nobody can question that is a what is a fake, either it is a false news, either it is for can't able to proven. So these things are words it will not come out once it is the scientifically proven. So that's the thing, research when you are doing should be have for practically should be scientifically show proven that what your solution has taken related of the research. Then next come for as a characteristics of scientific method. Some characters are must be for the to proven of scientific method, mainly orderly fashion, control, empiricism, generalization and theory. Based on these characteristics you are going to do for the proven and scientific methodly you can going to do for the nursing research. In the characteristics of orderly fashion and control, empiricism, generalization, theory. And first come for as a orderly fashion. What is mean by orderly fashion mean it should be for conducted in a orderly manner, means it is a step by step. You should not go for as a last step, middle step and directly should not go for as a summary. Whenever you are doing for the whatever scientific method, you should come for as a step by step. For example, one problem if you are taken, that problem have to be solved for the beginning stage onwards, it's not come for as a middle or last. So that is a orderly fashion. And control, so in a scientific research all external factors and extraneous variables need to be controlled to get the actual result without bias. So whenever the scientific research, whenever you are going to do for the related for the research are done, you should be get for the external variables need to help. External variables means whatever problem you are selecting and based on the persons you have to select, that we are calling as a variables, and it will be actual result it will come out for the persons. For example, if you are selected for any road traffic accidents in the teenagers, so that is a particularly you are selecting for the teenagers. So in the teenagers means you are getting for external variables means other people, you are selected for the normal people, so normal society people you are selecting for particularly age people. So teenagers means it is between for 18 to 20 years of age group. So these age group teenagers we are calling the, and we are going to do for research and road traffic accidents in the sense. So these are all the things will be for can control. So you can't able to extremely you can't able to do for the research, means road traffic accidents for all age groups you can't able to do. So that is the control. Some particular topics will be for some of the age groups will be there, so that if you are taken, then it will be very useful for that. And next it will be for empiricism. In all scientific research, data should be gathered in reality. So all the scientific research and data will be gathered for reality, mean persons will be should take for the whatever it's happened and what is the related, what is the questions. So like that you have to gain for the person is related for reality. You should take it. You should not take for any type of assumptions, and persons are taking for false news and approximately these things and all is not at all useful for this research. And next, generalization. So scientific method involves new knowledge which can be applied generally, not as isolated cases. So generalization means scientific method involves for new knowledge, so you can use for the new involves for the new knowledge, very important, and generally you can make it for the some isolated cases also. So generalization also can do, otherwise you can make it for isolation of people and you can do for the research. So generalization means all the public you will get for the information, otherwise which is the particular age group, either which is the places you are selecting, and specifically and that places also you can make it, and isolated cases you can deal with this scientific method. And theory. Scientific method provide new knowledge through the various investigations which will develop the theories. Scientific method will be provide for the new knowledge and various investigations are necessary, because that is will be how to proven. So that chart should be for correct. So because of that you have to make it for the continuously for scientifically you should do for so many investigations, then you will get for the exact result for that related of problem. These are all the characteristics are present for scientific method. And next come for as a purpose of scientific method. Why we have to do for the scientific method? What is the purpose? So mainly identification research, description research, exploration research and explanation research. So identification research lo you have to study for the normal phenomena of the where it will be known. So identification of research means you should identify the problem. So that is the first purpose you are going to do, means you are going to study of the normal phenomena. Description research means in the focus only prevalence, incidence, size and measurable attributes of a phenomena. So only you are focusing, this is the identification of research law. First you are going to selecting the problem. Description of research law you are going to figure prevalence for the only particular things, either size, either persons, anything you are going to measure, that is you are focusing. Description means in the description law clearly you are mentioning which is the place you are selecting, what type of incidents you are selecting, how much size, either age, anything it will comes under as a description research. Exploration research look you are going to do investigating full nature of a phenomena in depth. So your exploration lo you are going to mention what are all the things you are going to do for in research, that is the thing you are going to mentioning exploration research. Explanation research is to understand the underprinting underplanning of natural phenomena and to explain a systematic relationship among phenomena. So to understand the planning, both it will be, you have to understand and planning also it will be, but it should be for natural phenomena and you should explain for systematic relationship among the phenomena. These are all the purposes are for scientific method you are going to do. So what are the purpose means, first you should select the problem, that is the identification of research. Description research you should make it clear which is the selected of variables, and exploration and explanation method. So these are all the research through you are going to prove for the scientific method. And next one and same only purpose of scientific method continuation, that is the prediction and control also. So already explained we are selecting the problem and description is over and explanation also over. Now come for the prediction. In the prediction to investigate what will happen to either for phenomena to introduce for the investigator, means interventions, what you are going to do for prediction means what if you done and how you will get for the solution, that is a prediction. You will be have for one idea to do, how to do, that is the prediction. And control, so to understand how can we make the phenomena happen and alter its prevalence. So you can see understand how can you make a phenomena how it is happen, and it will be affected to the people. That is the control means based on the age wise, either it is related for the occupation wise, problem wise, you can make it for as a your phenomena and how it will be effect of the persons. So these are all the purposes sake you are going to do for the scientific method. And next come for as the steps of scientific method. In that 5 steps are there. That is a conceptual phase, designing and planning phase, empirical implementation phase, analytical phase, dissemination phase. So these are all the phases through you are going to do for the scientific method. So conceptual phase and designing and planning phase, empirical implementation phase, analytical phase, and dissemination phase. Same only. So how it will be doing for the nursing process, and as it is same you are going to do for is in a scientific method also some of the steps. So in that first you can see for very carefully for characteristics for the good research. What are the good research? So previously we studied for the previously we are studying for the steps of scientific method. You can see for conceptual phase, first you have to do for conceptual phase and description, designing and planning phase, empirical implementation phase, analytical you have to do for analyze, and you can make it for dissemination phase. These are phases are there for to do the scientific method. So in this scientific method should be have for you should do for some characteristics for good scientific method. In that, carefully designed and objective and logical, very important. Begin with a clear defined purpose and directly towards the solution of a problem based upon the observable experience and empirical evidence. Should emphasize the development of generalization of principles or theories, and should gather new data from primary sources of data. So first what you are going to do for in good scientific research means, first of all, what characteristics have to be means carefully you should design, means carefully you should make it for design, means you have for planning how related of the problem. So that is the designed we are saying. And next, objectives very important. All the type of any program, either any type of doing for research time, objectives are very important. Objectives means what you are going to explain in the research and what you are giving for solution to the problem. Everything it will be including in the objectives. So objectives was very important, and begin with a very clear defined purpose also. Why you are doing and what purpose you are doing and what is the exactly you will gain for that. So based on that you can make it for purpose, and directed towards for the solution of problem, and you can make directed of get for the solution to the problem. How to get, you have to make it for directed and based upon the observable experiences and empirical evidence. So observable also important, and based on that you will be get for evidences also, then only you will get for the problem solution. And should emphasize to develop generalization of principles or theories. You have to make it for some principles how to be followed for the to get for the questionnaires, either it will be generalized, either it will be the theories, whatever. And should gather for new data from primary sources of data. Nothing but where are the sources are there to get for the data. Either you are going to direct contact to the people, either indirectly you are going to the asking the questions, either you are collecting from the any journals, either in the newspapers, or either you will go for as a, some of the websites and books refer, anything it will be related of the two sources to get the gather the data. Next come for as a nursing research should be for good research based on the current professional issues, and emphasizes to develop, refine and expand professional knowledge, strive to collect first-handed information data conducted on representative sample based on the researcher expertise, interest, motivation and encourage. So based on these are all the things also you are going to do for the research. Current professional issues, mainly you have to select from the current professional issues, emphasize to develop for the what professional knowledge, how professional knowledge you will gain, like that you make it for as a professional issue, means updating issues. Strive and collect for the first hand information data. So you have to make it for the first hand data, means data you should get from the any places, either any sources also you will get, and conducted on representative sample. So you conducted for the sample means, so how many people you are selecting, that is 20 people or 30 people or 50 people are. Based on that you make it for as a samples like a questionnaires, and based on research expertise, interest, motivation and courage. So if researchers how much empathize means expertise, what is the expertise and what they are interested on motivation, courage also you can see for the good research. And come for as a steps for the nursing research. Already I said what are all the steps you can use for the research process. Mainly you can see for conceptual phase, designing and planning phase, empirical phase, analytical phase and dissemination phase. So first you will come for as a conceptual phase, formulating and delimiting the problem. Designing flow you have to make it conceptual phase. First formulating and delimiting the problem, review the related of literatures, undertaking clinical and field work, defining for conceptual framework, formulating the hypothesis. So formulating means making for arrangement. So that is a problem related. So process, you first of all you are selecting for any patient means you are going to do for first is the collecting the information, either it is objective data, either is this the subjective data, either you are anything you can do it for to collect from the people. So that is the information, that like that only you are going to do formulating of problems, delimiting the problem. So what is the necessary, that much content you will be able to collect, and reviewing the related of reviews. After that what you are selecting after collecting of the data, and you make it for as a reviews means so previously anybody has did for this research related of the problem, either it is nobody has done, and what to do get for the reviews, where if you get for the reviews, how to do for the reviews, and how to get for the related of this topic of content, everything it will comes under as a related of reviews. And reviews law you can get for as a previous reviews also and current reviews, and whatever are the there for the reviews you are going to do. Then undertaking clinical and field work, after completing of this collecting of reviews, then you are going to do for directly to the method, means you are going to for clinical side, either you will go for as a field, either you will go for as a generalized people, whoever the persons, and depending upon the problem. So that we can do it. And next defining the conceptual framework, after of conducting of these are all the things, you will make it for one framework means you will get for one idea how to do for the research, that you are going to do, and is in a framework means these are all the things you are going to done, and these are all the things will be the pending. On this two if you go for as a how you can make it for as a problem solving. So step by step, that is we are calling as a conceptual framework. And formulating the hypothesis, so hypothesis means it will be very necessary for hypothesis. So in the current issues if you are selected, so in that you can see for so many hypotheses. Later I will discuss about the depth of the hypothesis means nothing but related of current issues you are going to do for the research. And next come for as a formulating and delimiting the problem. So mainly first identifying interesting significant research problem, and research question, common sources research problem. So mainly example substance issues, theoretical issues, clinical issues, methodological issues and ethical issues. So you make it for formulating of delimiting the problem. How we are going to do means you are identifying, and you can get for significant of research problem and research questions, and you can make it for as a like a which are all the issues will be there for in a society, that is a substantive issues. This research question is very important. And theoretical issue also will be there, means questions how you are making that, how it is the related of problem, that is a theoretical issue. It is a broader conceptual contest to understand the research problem. And the clinical issues, could research findings be useful in clinical settings. Methodological issues, how can these questions be studied to yield evidence. Ethical issues, can these questions be rigorously addressed without ethical transgressions. Based on these are all the necessity of issues, and you are doing for formulating and delimiting the problem. And next one is reviewing the related literature. Quantitative research will conducted in the context of previous knowledge, and it will be researchers to know about the what is already known about the research problem. A thorough literature review provides a foundation on which base new evidence, and usually used for conducting well before data collection. For clinical problem, it is preferable review the existing practice guidelines. Reviews means already explained previously what are all the conducted for this related of problem. That previous knowledge you must be gather it. And next, related of literature, you can provide for the what is evidence of conducted, means how they collected for these research reviews. Before the collecting of data collection, you may conduct for the people. And finally the clinical problems are there, you can prefer for the existing practices guidelines. So these are all the things you are going to do for in reviews. And undertaking clinical field work, so in this undertaking field workflow, you will get for as a required clinical basis research studies and further help to the develop methodological strategies. And mainly the objectives will be observe the clinical setting first, discuss with the clinician and monitor current practices and current clinical trends. Based on that, you will get for the clinical field work. Mainly you will gain for clinical knowledge and clinical field work. It is very important, very required and to do for the research studies. Developing of methodological strategies, in that mainly you have to observe for the clinical settings first, and you have to discuss with the clinics, and you have to monitor solve the problem. These are all the undertaking of clinical field work. Next come for us defining the conceptual framework, formulating the hypothesis. So defining the conceptual framework, when the research is performed within the content of theoretical framework, the findings may have broader significance and utility. So when the research conceptual framework you are how to be performed, means you should get findings of the significance, and who are research questions you are embedded for theory and must be clear, and that has to be development of conceptual definitions has to be done. Based on that, you make it for the conceptual framework. Formulating hypothesis, in that statement of researchers expression about relationship between the study variable and expand result of a study. So research question is pre-eclampsia toxemia is related the stress. So hypothesis means women with the stress will be more likely than women without stress. The expression will be eclampsia toxemia. So this is a question they are asking. It is the pre-eclampsia toxemia is related to stress. So in the hypothesis, women with the stress will be more likely than the men without stress. The expressions will be eclampsia toxemia. So this is a one example giving for the formulating hypothesis. And next, okay. And then next class I'll explain about the remaining content of nursing research process. So everyone hopefully understand about this nursing research process, and please subscribe, like the video, and any questions or any doubts are there in next class, you can make it for reviews, so you can write, then I can able to give for the answers for that. And it is very helpful for you when you are going to do for the nursing research competitive exams. And mainly these are what all the exams are coming from in the recently. All the problems they are asking related, means maximum it is the 20 to 30% of paper they are asking for nursing research questions. So please follow that, and nursing research will be important for that. And very confusionally they are asking the questions, so very difficulty if you are not understand about the research. So be careful. All the best for in your future. If you want, please subscribe and like the video. Thank you.